Hello and welcome to Let's Pod This. My name is Andy Moore and I'm here with Bailey Perkins. Hello.
Hello.
Arthur Over, Scott Melson. Hello, sir.
What's up, y'all?
How are you guys?
It's Friday. It's Memorial Day weekend, so no complaints over this way.
What are holidays anymore, right? There's just additional days that we move between the same two rooms in our house than we are the rest of the week.
Hi, man. I am 100% ready for the 3-day weekend.
Well, that's true. Scott, you have a job outside the home, and we thank you for your service on the front lines of medical care. So we, I think I wanted to start today by acknowledging that this morning, Senator Allison Eichley Freeman from Tulsa, on her way to the Capitol from Tulsa, was involved in a collision. It seems like it's pretty bad. She is at OU Medical Center. The other motorist that was involved in the collision died at the scene, it sounds like. And so on behalf of the podcast and Let's Fix This, our sincere thoughts and prayers are with Senator Freeman, with the other driver's family, with all their families. It was a surreal and tough start to a very busy legislative day today.
Absolutely.
All right. So, man, where to start with what happened this week? The legislature never fails to really pack in just everything in the last few days of session, right? Scott, I know you were in clinic today. I just kept texting you like, oh my God.
It's like, it's even on years when there's a global pandemic and you think there's not going to be that much for them to do. It still ends up being crazy time.
They find a way. So today they officially ended or, adjourned sine die for both the regular session and the special session. The special session, part of that was coming back to say that CHEPA, the Emergency Health Emergency Act thing that we've talked about a lot on the show, will officially end May 30th. And they have no intent at this time to renew that. So no additional powers for the governor after next Saturday. Do you guys think that means that Governor Stitt will also be ending his emergency declaration or his state of emergency declaration in the near future?
Well, I hope it doesn't mean that because I think that would make a bad signal to the public that everything's good, coronavirus is over, as Scott always jokes around. And so I think it's necessary for him to maintain that power until we have more certainty about what's going on. Because, a lot of experts expect a second wave to hit. And so especially as we're opening up everything, President Trump made a comment of wanting the churches to open right now. And so as more people go back to interacting with one another, the governor has to be prepared to act should more cases spike in the future.
Yeah. I think, go ahead, Scott.
Yeah, no, I was just going to say, I honestly don't know what to expect from the governor in terms of what this does or doesn't mean for the state of emergency, because on the one hand, there are 70 new cases announced today in Oklahoma County alone. Today is the biggest one-day spike in cases since April the 4th. We had our 25% increase in hospitalizations over one day earlier this week. Now, it bears repeating, and this is something this is important to remember. Those things in isolation don't mean that we're seeing a second spike or a second surge. Those are just two data points that happen to happen this week. But I think it is clear that those don't support the idea that we're done, or that we're continuing to see this steep decline. And so I think on the one hand, for the governor to end his emergency declaration, I agree with you, Bailey, would be premature. But on the other hand, if you're the governor and it's kind of open up, move on to phase 3, we're meeting the gates that the that the White House has set out, even if we're not totally meeting them in actuality, what is the justification if you're the governor to keep the state of emergency in place? Like, that's my right. Like, that's my question is I don't feel like the public health emergency is over, but I also feel like everybody really wants to say it's over. So like, how do you walk that line? And I don't know the answer.
That's tough because we all want it to be over, but just because we want it doesn't mean it is.
Right.
And that is, I was listening to a 538 Politics podcast, and they were talking about the same thing, right? That it's nice outside, people want to go outside. It's really tough. For Oklahoma, arguably it'll be easier for us to respond to the pandemic in 2 months when it's 105 degrees outside and nobody wants to go outside. So we'll see what happens. Related to that, also today, it was just a busy day. This morning, Governor Stitt named Colonel Lance Frye, who's a medical doctor. He's currently the chief flight surgeon for the Air National Guard. He's the new interim commissioner for the Department of Health. Gary Cox, who has been the commissioner for a while, or interim commissioner, as listeners may remember, was not confirmed by the Senate a few weeks ago. Senator McCortney said the votes weren't there, owing to Gary Cox's lack of the academic credentials required in statute, and because he is an attorney, I think, and while he has worked in public health for a long, long time, he didn't have that degree.
Yeah, it requires a graduate degree in public health or medicine, right?
Right, yeah. And so obviously Colonel Frye does, medical doctor for 20 plus years.
And according to Carmen Foreman in the Oklahoman, she mentioned that he's in OBGYN by training.
Yeah.
So
interesting.
And I believe I think he's the head of the obstetrics and gynecology residency at the Hillside Center at OSU, I think. So he's he's a clinician, but he is also an academic clinician.
Yeah, and a practitioner, which is, and honestly, that is a good skill set. Maybe it's not as directly applicable to a pandemic. However, Oklahoma is one of the states with the highest teen pregnancy rate in the country and really high STD rate. So these are skill sets that are relevant.
Yeah.
All right. So shortly after that announcement, the Oklahoma Employment Security Commission, which is the agency that handles unemployment, right? So I will say the unemployment office for ease, so most of us know what it is, right?
Right.
They do other things, but that's kind of the big thing. They had a meeting this morning with an executive session, and they were going to vote on, and I honestly don't know what the outcome was, you guys might, about consolidating their IT practices and their business practices with the Office of Management and Enterprise Services. Do you guys know what they decided to do with that?
I don't know the outcome.
I hadn't seen the outcome yet, but even without knowing the outcome, I think that it is worth mentioning. Okay, people bitch about OMES all the time. They talk about getting rid of it. They talk about whether or not they should have even done it in the first place. Whether they function well at their job of consolidating IT and whatnot. And apparently the situation at OESC and their technology is so bad that they were you know what? Maybe we should talk about just giving it to OMES. Right.
So it made me think of there was three things that I thought were a little ironic about this. One is that this is maybe another example of yet another state agency that is crippled by poor or outdated IT infrastructure, right? You can't run a government that's functioning on Windows XP, right?
Somehow the tag agencies make it work on DOS. I don't really know how, but they
fascinating.
They seem to get by.
It's rock solid. If you have a very specific purpose, you keep it simple, right?
But it's that conundrum, though. So people, want government to function, but we don't want to invest the things that help government function. So right. So OMES, as Scott said, was created for this purpose, right? The idea was to consolidate all of the
administrative and IT services for all the state agencies into one agency.
Right.
So it's all there. But not every agency has gotten on board with that, as we've seen repeatedly, right? In fact, I think the Department of Health just did in the last few years. But yeah, also, if memory serves, didn't Governor Stitt run on or talk about doing away with OMES last year or the year before or this year?
I think the governor did, but a bunch of other people have too. That's why I said this is ironic and kind of funny. It's the OESC is man, we need to get out of the IT business and just give it to OMES. And it's are they going to be around? And
right.
a lot of people,
right.
a lot of people feel like they are not very good at it. And again, there's very nice people at OMES. I'm not blaming them for this. I think they're under-resourced. I think it's a whole number of problems why that agency hasn't been as successful. I too think it's a great idea to have the entire state government operate under one tech umbrella, right? Everybody's using the same programs, they talk to each other. I think it sounds good, but it's really hard to do in practice, and it costs a lot of money.
Yeah.
Yes, really tough to get there, right? That's the hard part.
The front end costs are there, but over time you'll see efficiencies. But we got to get to that first threshold of making that investment first, and I don't know if we're willing to do that.
Bailey,
right.
you're asking the legislature to think that if they spend $1 billion now, they might save $3 billion over the next 10 years, but they never get to that save $3 billion part because you can't get past the spend $1 billion now.
Right.
And I don't know, I have no idea how much it costs. It's probably not $1 billion, but it's a lot of money, right?
No, but also these are enormous agencies, right? And so if you want to think of them as companies, sometimes it is difficult, right? So if the health department needs something that is specific, right, but it doesn't work, then it's hard to get another entity who is also big and sluggish to move to make it happen. For example, in my experience, running the HIV program at the university, which is not technically a state agency and thus not under OMES, we had a database that we needed for our HIV patients that we needed to share with the state. But because their IT security people were different than our IT security people, we couldn't get it to work. And so we had to do this export, send, import data thing. And it made the whole process much more cumbersome, but it just wasn't an option. So the answer is there's no good answer, right?
Yeah. It is interesting though. I mean, not to dwell on this, but it is possible for this to work and work the VA is a great example, right? The VA operates multiple hospitals in all 50 states. It employs hundreds of thousands of people, and they have this network of computer systems that can pull data. When you're seeing it, when I was a resident seeing patients at the VA, and they got maybe an EKG, right? So a tracing of the electrical pattern of their heart. I could look at their EKG and man, this they're not in a heart attack, but this looks kind of funny. Have they ever had an EKG before? And I kid you not, I had a guy one time I was seeing that I looked at his EKG and I could go back in the computer and I was able to find a scanned copy of the EKG he had done in 1992. And it looked exactly the same. It was okay, well, it's been doing this for 20 years, so it's probably fine. We don't need to bring the cardiologist in the middle of the night. So it's if government can do these kinds of things and do it well, it just takes a lot of investment. That's all.
That's reasonable. Related to OESC, this afternoon, just a little while ago, news broke. I don't know if you guys had a chance to see this, but Robin Robertson, who is the executive director, stepped down.
Yes.
She was just hired in January, I guess, before all this COVID mess started. I don't know much about her. She's got some kind of background in IT, and I think was brought in because of their issues over there. Obviously, not enough time to really put anything in place when the epidemic started, just a few weeks later.
Yeah. She inherited a really tough situation.
Yeah. And she said in her interview with the Oklahoman, which I think listeners should read, it was interesting, that she had 5 calls yesterday asking her to step down. And so it's oh, okay. This was really
an administrative leave, taking an extended leave. And
yeah.
she wasn't interested in doing that.
Right. Which I get. It seems to make a lot of sense.
Yeah.
All right. Well, so that was all before like 10:30 this morning, with exception of Ms. Robertson stepping down.
Well, and Andy, and while we're on the topic of OESC, is really interesting. Congresswoman Horn did an unemployment assistance survey among constituents and had some really interesting figures of like how people were able to engage with the agency. And one of the questions, for example, said, if you had applied or attempted to apply to receive unemployment through OESC since February 1st, how would you rate your experience with the application process? And 78% of respondents said negative. And so a lot of the feedback was, people still haven't been able to get in touch with somebody. They've had negative experiences. 42% said, they weren't able to complete their application due to the problems within the system. And so COVID has really put pressure on an agency that was already understaffed, underfunded, that didn't have the tools that it needed for a moment like this. And so it was just really interesting to see that information that Congresswoman Horn collected play into probably why they're looking for change in different leadership into the agency. But like we noted, it shouldn't be blamed on just the new executive director. This is something tough that the agency wasn't structurally prepared for. Right.
Yeah. Yeah, that's a really good answer there. Man, all right. So are we up to all the bills and the vetoes now? Is that the next?
Let's get into it. There's a whole lot to talk about. So
yeah. So the governor had a very busy week. As is always the case, the legislature at the end of the session sends a bunch of bills over. Right. It's always in the last few days, and so it looks like this year, and I think the website's still updating, but as of a few minutes ago, he had signed 134-ish bills. And I do want to mention that a bill we mentioned last week, the cost of living increase for retired state employees, was one of those bills. That's the first one in 12 years, Bailey?
Yes.
So it's
been a long time coming for many state retirees to see that bump in their pension.
Right. And it's not like it's a huge bump, right? But the cost of living has gone up in the past 12 years. And so we have to help support them.
I think it also bears mentioning too, just because we, and by we, I mean all of us, but mostly I, ranted and raved about this last week, that some of the bills that we were most concerned about did not make it all the way through. So there was a change to vaccination rules that I don't think made it all the way through, or well, I should say the legislature wanted to block the rule change, and they were not able to do that. So the recommended change in rules that the health department propagated will go through as part of the omnibus rules package. So that's good news. Another one was that the local control bill that would require mayors to ask the governor's permission before declaring a health emergency, that also did not get through the Senate, I think. So that did not go to the governor's desk. And then finally, the bill that would have capped, Bailey, did the housing bill.
He vetoed it.
Yeah, he vetoed it, right? Yeah. Yep. So that's.
It would have lowered the cap of the affordable housing credit. So.
And then they did not increase the cap on the Education and Opportunity Scholarship Fund, right? Like that didn't go through either, did they?
I didn't see any movement on that.
Okay, no. So perfect.
So all the stuff we talked about before, that's where they are.
Well, and so I've compiled, I think I'm still missing a few, but I'll put all of these into the show notes for the podcast. And if you are watching this on Facebook or YouTube, on our YouTube channel, I try to put all this stuff in those in the description as well. So please go down and check that out. There were a bunch of bills that the governor vetoed, and then a bunch of those that got overridden, right? Some we talked about last week related to the budget. and then others this week about a whole bunch of other stuff. So I'm going to kind of go through some of these, and we can probably pop on and discuss whichever ones. They're not all worthy of discussion, in my opinion.
Or we just don't have time to discuss them all, frankly.
That's true, yeah. One that I think is interesting is was Senate Bill 1703, which would have created a sales tax exemption for the University Hospitals Trust. So in Oklahoma, just because you're a nonprofit doesn't mean that you are exempt from sales tax. You have to get a special exemption. It's like a case-by-case deal. This would have been about an $11 million per year, I think, savings for basically for OU hospital system. Yeah. And that obviously if they're saving that money, that it's taxes that they pay, sales taxes they pay, then that means it doesn't go to the state into the general revenue fund. So it's, money is fungible to some extent. And in Stitt's, it was going to be used to fund additional residency slots at the teaching hospital. In Governor Stitt's veto message, he said the state needs that money, and there's no requirement that they spend it on what they're going to say they're going to spend it on, basically, which was true. And I think this is a funny thing that will come to another bill,
it's
right?
Theoretical for sure. Yeah.
Yeah. I mean, the legislature is always like, we're going to spend this money on this thing. But it's so often they supplant that money with something else and just, we spent this money on this, and then we took the other money and spent it on something else instead. Yeah. So there was that. There was House Bill 27.
Before we move on that, it's just really interesting because, $11 million is a drop in the bucket. And so...
for the state budget, that's,
nearly $9 billion. Yeah. So it's really interesting that that decision was made to not fill those important residency slots that we need. So
well, but the legislature has been cutting higher ed budget, and I think this is all kind of related, right, for years.
Yeah.
And so that OU, while we think of it as a public institution, the portion of their budget that they receive from the state is, I think, less than 20% for sure, maybe less than 15. Yeah. And so they are just barely, they're a private institution who happens to receive some public dollars at this point.
Yeah, a few dollars from the state.
Yeah. So we mentioned the affordable housing tax credit and the private vocational school rule change things. Those got vetoed and were not overheard. House Bill 3663, which would change tag agencies' employment relationship from the state from being at-will employers to just cause. So essentially employment protection for tag agencies. Governor Stitt said he didn't believe they needed any additional protection, vetoed that, and the legislature did not override it.
You know how many tag agents we get rid of in Oklahoma every year?
None.
Less than one. It's not zero, like it happens sometimes, but the moving average is like less than one.
Do we add more each year then too?
Not necessarily. It just depends. So apparently I learned this week. Every county is required to have a tag agency, and if the county doesn't have a tag agency, then the tax commission is supposed to act as one, but sometimes the tax commissions don't want to. But yeah. But no, tag agents are at will. They're at will and can be anyway. So
interesting. So then House Bill, let's see. Oh, this is a big one that I think we should have another episode on. House Bill 3828 is going to make a bunch of changes to medical marijuana, right? And I think this was requested, at least in part, by the Medical Marijuana Association Administration.
Did they not override this? I thought they were going to override this.
Fetgetter said he called for it to be overridden. He didn't call for it on the floor, but yesterday he was talking about it, and they didn't.
This changes, like, this would change like whether or not they can deliver. It would have made a 90-day license that can be renewed a thing. It was a substantial bill that was negotiated between the Medical Marijuana Authority and the industry, and everybody was like on the same page, and then they passed it, and then the governor was like, "Nah, I'm good."
Yeah. It was. I think we'll hear a lot more about that soon.
Yeah, I'm just surprised because I would have thought like that one in particular. I would have thought they were going to override today.
Well, and it passed the House 90-6 and passed the Senate 38-5. Like it was, they had veto-proof majorities there, and they just chose not to go back. So,
well, speaking of vetoes, we should definitely talk about the Medicaid expansion funding.
Yes. So I've got two left on this little list, and we'll get to that. Well, that's one of them. So House Bill 3824 exempted the legislature and state judicial entities from fees and costs for services rendered by appropriated state agencies. So basically, this bill would have said that the legislature and maybe the judiciary doesn't have to pay the same fees for like services from OMES or some other state agency that the normal interagency things happen. And this is an odd deal to me anyway, right? This is like, it's like two divisions of the same company paying fees to one another for their services, right? So like if you, I don't know, like Alphabet, right? That's Google's overarching company. And so if Waze, like their traffic app division, wants to use Gmail, do they have to pay for Gmail like out of their budget, or does it all? Right. And it's a way to like transfer costs within the company, and so that's what it is within the government too. And so right now, if DHS needs something from the Department of Health, they may have to pay some kind of fee. And the legislature was like, "Oh, we don't want to pay the fee," and the governor said, "This is just shifting costs from one agency to another, while other state agencies have to pay it. It's not fair for you to be exempted from that," which.
That makes sense.
Enough. Yeah. I was like, was this the legislature trying to save money at the expense of taxpayers? That seems unfair. So there's that. And then the last one on this part of the list, Bailey, is Senate Bill 1046, which would increase.
Threw everyone for a loop. So
yeah. So this was, last night, late into the night, the governor was signing bills, doing little Facebook videos, and vetoing some of these. I don't think he did Facebook videos for vetoes, but this was the increase in the hospital fee that would raise $134 million to basically pay for Medicaid expansion, whichever version of Medicaid expansion makes it across the finish line, right? So whether it's the governor's Sooner Care 2.0 or it's State Question 802, like at the ballot, and so the governor started this year talking about Medicaid expansion, Medicaid 2.0 or Sooner Care 2.0, and here's my plan for it. And the legislature passed it and agreed to expanding Medicaid, which is still a little bananas given how much they've pushed back against it. And then the legislature passed a bill to fund it, and the governor said, "No, never mind." In his veto message, I don't have it pulled up, but it's super weird, right? Like where he's like, Oklahomans need healthcare, and we're going to give them healthcare, and we're going to have a plan to do it.
Well, one of the arguments was that it doesn't fund it through its entirety; it just funds it through the first year, and so he wanted something that was going to be more sustainable over time to fund that state share portion.
Do you think that's really what it is, though?
But is this now the time to have that conversation at the sign into law or veto table, right?
So here's what he said. So he said, "I appreciate the willingness of the legislature to craft a proposal to fund Sooner Care 2.0. When I announced Sooner Care 2.0, unemployment rates were at 3.2%. Due to the current COVID-19 pandemic and uncertainty within energy markets and commodity prices, unemployment rates are predicted to be as high as 14%. I would throw out there, they're actually predicted to be as high as 25%, but that's neither here nor there. This will not only increase the number of individuals currently enrolled in Medicaid, but will also increase the number of potential enrollees in the expanded population." And he said, the other thing is that SB 1046 does not fully fund Sooner Care in year one, and it does not consider funding for year two. We must work together to design a healthcare system that's both affordable and sustainable and that addresses the unique needs of Oklahoma while improving health outcomes. From the day one, I've said one-time funds are not the way to pay for Medicaid expansion. I will always protect the taxpayer, and I will not sign unfunded mandates in the middle of a massive budget deficit. So, I honestly, this is probably not a popular opinion. I'm going to say it's probably an unpopular opinion. I have mixed feelings about this. On the one hand, I'm 100% in favor of expanding Medicaid to the largest extent possible. I think that's something we should have done 10 years ago. We certainly need to do it now. And I think that doing this is what I think that SB 1046 is probably what we should do. But that's not to say that here the governor's points are entirely without merit, right? Like I, you know what I mean? Like, I think that I wish he'd sign the bill, because I think the sooner we can get healthcare expanded, especially, I mean, I shouldn't say especially, to everyone who needs it. I mean, people are being devastated right now. I think that, we talk a lot about how much rural healthcare and rural clinics and hospitals have been devastated. And that is certainly true now, even more than it has been in the past. But people are hurting in our cities too. So I think that the sooner we can get healthcare passed, the better. But I also think that the governor is right that, like, one, because of a lot of things that are out of our control, this bill wasn't going to be enough to do it, right? And it doesn't address what comes next. Now, the other thing about this is that this is funded by raising a fee that hospitals pay, but rural hospitals are exempt, so it'd be mostly urban hospitals that would be paying this fee for this $134 million. And hospitals all over the state, all over the U.S., wherever they are, hospitals are hurting right now. Hospitals are feeling incredible financial pain right now. So, I'm sure if this had passed, they would come up with the money somewhere, but that's another reason that this is a little bit more nuanced than just like, oh, we should do this to fix healthcare. I think it's probably the right thing to do. And I wish that he'd signed it so we could be further on down the road. But I read the governor's statement and, in somewhat out of character for me, having read his statement, I wasn't like, garbage.
But it leaves a lot of questions unanswered, especially for many health advocates who are following this. There are folks asking what happens now with your July 1st marker for starting Medicaid expansion this year in the state. So now that we don't have a funding mechanism, what does that look like? Do you still carry on with Sooner Care 2.0 and the submission of the CMS waivers? The CMS say, oh, you don't have a funding mechanism now, so we're going to reject it. What does all of this mean in terms of the governor's plans to expand Medicaid now that we don't have this funding mechanism? And
that doesn't even touch on 802, right? Because 802 just says expand Medicaid. It doesn't have a funding mechanism, right? So
and it starts 2021.
Yeah.
So this would give the legislature, regardless of the governor's plan, if State Question 802 passes, it gives the legislature this next session to put in a funding mechanism. And so it's really interesting that this was vetoed for his Medicaid expansion plan, and what does it look like for his plan going forward and its ability to be implemented in 2020.
The other thing that's interesting is that he vetoed SB 1046 because that provided $134 million for Medicaid expansion. The total cost of expansion was estimated to be $164 million. So there's another bill, SB 1935, that authorized using $30 million from the Revenue Stabilization Fund to make up the difference. So he signed that one. So he signed the bill for money that's one-time funds going from revenue stabilization for $30 million. But he didn't sign the one for $134 million. That's one-time funds from this fee increase. So it's a little bit incongruent.
Yes, that's a good word. Yeah. I think that was the deal for me. In watching it, was that it definitely seemed like, or reading it, it definitely seemed like his strategy changed midstream, and so when he put that veto out, everyone was like, well, this is weird. And then, it's a political talking point, so it's not like a real message of like, you know what, after looking at this again, I should have vetoed the other one, but I'll veto this one, and here we are. So what a weird mess. And so still we have unanswered questions about the future of healthcare in Oklahoma.
Yeah.
I'm shocked. Shocked, I say, to find that there's gambling taking place in this establishment.
Scott sends me that GIF once a day, probably. All right. So in addition to all of those vetoes that went through and were not overridden by the legislature, there were 6 bills that were overridden today by both chambers. It went through pretty quick. Most of them had veto-proof majorities in the first place. And so as he vetoed bills last night, they put out their agenda like around 11 or 12 last night and said, okay, here we come. And this is in addition to the 4 bills that he had his vetoes overridden last week, right?
Right.
So that's 10 altogether. So,
and that's very rare. You may see 1 or 2 within a legislative session, but not several. So this is very unique,
right?
Yeah, several people have asked, and so I'm curious to find out.
Especially within the same party. So
right. Yeah, you government control with one party. It's crazy.
Right, that they can't get on the same page. So House Bill 2749 and 2750 worked in conjunction to authorize $161 million bond package to fund the state's matching obligation for endowed chairs. And it says it like basically caps the state's funding on endowed chairs. The way the legislature talked about it, I'm a little confused. I need to go read it again because Stitt's veto said, he's like, I'm vetoing this because I don't think we should fund endowed chairs at all.
At all, yeah. And
the legislature said today, that's what this bill does, is basically it gets us out of the endowed chair business.
Well, but they also mentioned like they don't have a say in which chairs get endowed. So that was their issue too, is like they wanted to say, we're going to endow the business chair, but not women and gender studies. Like, like it's, I think also a very political jab at higher ed because people view higher ed as an incubator for ideological ideas instead of a place of, developing critical thinkers and all that kind of stuff, or building the next job. So I think there's just biases even towards higher education that goes into play about why they want to get out of the endowed chair business.
Yeah, sure. So that went through pretty quick. I mean, they more than 90 in the House and 44 in the Senate voted for that. So that went through pretty easily. For anyone who didn't watch debate on these today, it was interesting because there was a lot of shade being thrown at the governor, also on Twitter from members of his own party again. But even today, they were like, yeah, there was a lot of factual inaccuracies in the governor's statement. And they were kind of like, ha ha, slapping each other on the back of like, that's a good one, and some real zingers. And it was a kind of a bizarre scene. House Bill 3819 would make any contract from a state agency open to inspection by any member of the legislature, and also banned any agency from prohibiting an employee from talking to the legislature. So this is I think, a couple of years, we've seen this trend of like the legislature wanting more access and oversight over agencies and more involvement, right? Just like last session, the big deal was about the Board of Regents for higher ed, and that any legislator should be allowed to attend and sit in on the executive sessions of those that are not normally open to the public. So this bill passed the House 94-1 and the Senate unanimously. Stitt said the measure is duplicative, detailed some concern about how confidential information would not be protected, and observed the legislature did not make its own contracts or employees open to inspection, which is true.
There's no there's no good guy in this fight.
Right. That's fair. That's fair. I mean, I think this is the legislature saying we want more oversight over agencies, and I think this is the governor saying back off. The agencies are mine. Like, you write the laws, but I run the agencies, because he's kind of had that rhetoric the last few weeks, right?
What? And the legislature's given him some of that power, so it is kind of confusion and mixed messaging.
Well, and this is like a confidential information. Like, when I tell my agency head stuff that I don't want the legislature to know about, that like, it's just, I don't know. It's I mean, fine. They passed it. Fine. He vetoed it. Fine. They overrode it. Fine. Like, this to me it's a contest about who can get their pee farther over the line.
Fair enough. So that also passed again on about the same margins. Almost everybody, both parties voted for it because it gives the legislature more authority. So why wouldn't they vote for it? House Bill 4018 was related to the Rural Broadband Expansion Council. And so Stitt obviously vetoed this and said, well, this is part of my digital transformation plan. And there was another bill related to that, two other bills, House Bill 4049 and Senate Bill.
Was that the speaker's bill?
I don't remember. I didn't write down the authors.
Okay.
But there was, House Bill 4018 and Senate Bill 1002 were like trailer bills, both related to rural broadband expansion. And they both passed, I think, both chambers unanimously or nearly unanimously the first time around, and they did with the veto override. And this goes back to the budget fight, right, where the governor was saying, like, I'm in charge of digital transformation, and that whole deal with that little bit of money for this that became like a big issue, and why he allegedly, vetoed the budget or pushed back. And so growing up, I used to watch wrestling, like WWF, or I guess now it's WWE, but back then, different. And in that, you would see, someone would like hurt their elbow. I'm doing air quotes here, but hurt their elbow, and then the other guy would like just hammer away at that elbow. And I feel like in this wrestling match of our legislature, then it was like the legislature figured out that digital transformation is the governor's elbow, and they're just hammering away at it, like however they can, because they know that like it probably doesn't matter in the grand scheme, but it really drives him nuts. And it's like, it's like King of the Hill, a little fighting over a little thing.
Yeah. I mean, because I think that connects to that tension, particularly, if I can get the words out, between the governor and the speaker. So, because we've seen a lot of tension among not necessarily the legislature as a whole, but even among leadership and the governor. So that's been an interesting, and that analogy too is fitting in this, that there's this kind of back and forth kind of ping pong one-upping. So
it's real interesting. And then the last one I had on my list for us to talk about was, and this is the last override, is House Bill 4049 that dealt with fees and how it relates to the online motor vehicle registration system. I think now, and I've talked to some insiders about this, when you go to renew your car tag, like you can go to a tag agency or you can go online.
Yeah.
If you go online, there's a list of all the tag agencies in the state. You can pick whichever one you want. And it also lists the Oklahoma Tax Commission. So you can circumvent tag agencies and just pay your tag straight to the state, right?
Yeah. Mm-hmm.
And, tag agencies, they are job creators. They employ people, but they're also kind of an institutional monopoly in the same way that like electric companies are, right? Like the state uses them. Everyone I know who owns a tag agency or affiliated with one, I guess that owns it, it's a pretty lucrative deal, right? Because all of your fees are set by the government, including your profit margin, and like your guaranteed business, as Scott said earlier, you're guaranteed to have one in every county.
Yeah.
And
everybody's got to get that tag.
So given an option to circumvent them, obviously tag agents don't like that, and I'm guessing, right? They've got a powerful lobby, and I could see them pushing to say, "Hey, listen, can you get the tax commission like off that list, or put them farther down the list, or something, so that there's a better chance that people will pick me, right?" And I would also expect that, like, I think it's an alphabetical order or something. So whoever's, AAA tax or a tag agency is probably the first one, and they might get a disproportionate share of revenue from this. So the online system is real funny to me. But it was, again, this had one of the lower margins, and that's not saying much. It was like 89-7 for the veto override. And Stitt's veto for this said it hampers digital transformation, and because he believes in a future someday where all Oklahomans will access all state services through a mobile app, which is obviously not the near future, right? Like, we still don't even have real ID. And so
that
the idea that
and the deadline's still ticking. So, because that one has a real deadline. So
yeah. So given all of this stuff, right? So we went through a bunch of bills, and sorry for listeners that was in the weeds to some degree.
Hey man, that's why they listen to this show.
Well, we hope. One can hope. Let's talk about this, like, pull back to the 30,000 feet, right? That this relationship between the legislature and the governor. And in fact, just in the last few days, I think NonDoc had articles about, he definitely had one about Treat and the governor. Maybe the Oklahoman had one about Speaker McCall and the governor, right? That there was the kind of end of session thing that they had words, or they worked it out, or whatever it was. It made it clear that, like, those relationships with the leadership, the House and Senate leadership and the governor, have soured a bit.
They're
strained. But the governor has gone out of his way, I think, on several occasions to say, I've got many friends in the legislature. We get along great. And in one of the interviews, he said, maybe not the leaders, but a bunch of the rank and file members were cool.
Which is great, except it turns out that nothing gets heard on the floor of the House unless the speaker and the majority leader, the floor leader, decide they want it on the floor, right? Like, that doesn't happen.
And the pro tem on the Senate side, so
right? Like, it doesn't matter. So I think it is commendable for the governor to try and have good working relationships with rank and file members of the legislature. But if he doesn't have good working relationships with leadership, he's going to have a hard time having his agenda get passed.
Yeah. So what do you think this means moving forward, right? What does this look like for the rest of this year, going into next year? How does this change the dynamic inside the Capitol?
Got a hot take.
What's happening?
It's not going to.
I mean, it may turn into, water under the bridge. I mean, it really just depends on what happens in the next several months, to see how their relationships will either mend, or if there's something that may appear that may force the legislature to have to come back. And I mean, because again, we're still in an unprecedented time with COVID. So who knows what may need to happen for the legislature and the governor to have to work together. And so I think time will tell.
Yeah. The reason I say it's not going to is because, barring something unexpected at the ballot box in November, the Republican caucus will have veto-proof and veto-proof supermajorities on their own in both houses of the legislature. So I think from their standpoint, all they have to do is keep their caucus together and they can do whatever they want, right? They don't need to work with the governor. They don't need to work with the Dems. They don't need to work with anybody to do whatever they want to do, because they hold 76 seats in the House and 35 or something in the Senate. So the House or the legislature, the Republican caucus has no incentive to work with anybody because they have the Trump card, so to speak.
Right.
And that's why I don't think that is going to change, which is why I don't think the dynamic is going to change. Who has leverage over Speaker McCall? Right. Who has maybe Treat? Right. Who has leverage over Treat? Maybe McCall.
No, but I mean, I think years past, their dynamic indicates that that's not the case, right?
But that's what I'm saying, though, right? Is that like as long as Senator Treat and Speaker McCall are on the same page, then like they can do whatever they want to.
They're a powerful force, yeah. The legislature.
Well,
that makes sense.
Yes, definitely. And I think in some ways we should be cautious, right? Like I'm. This is maybe it's one man's opinion, but this session in the last few weeks, we saw the legislature argue that there are 3 co-equal branches of government, right? And yes, they did things within their authority, but when you have such large supermajorities of any party, right? Like you run the risk of this happening where the judicial branch made a ruling and the next day the legislature overruled them, where the legislature passed bills and the governor vetoed them and they came back and overrode those vetoes. And so they kind of set a precedent of like, they flexed, right? Like they were showing what their power is. And
if this is the agenda that we have set, we will see it through.
Yeah.
Right.
And there are 3 co-equal branches of government, right? But I think the answer is like, if you want those other branches to be a check on the legislature, then you got to vote, right? You got to vote, and you got to vote for different people, right?
Right.
That's just like,
and arguably there are things that they, as I said, like they worked within their power there, and they just flexed to remind us, the people, how broad the government's power might be. And I think, we see how broad the people's power is too, right? Like next month, we'll vote on State Question 802, which is an initiative petition to amend the Constitution.
Which we have the ability to do for now.
Right.
Pending a constitutional convention.
Well, and that bill didn't go anywhere, so there's that.
Yeah.
Hopefully. But I think, barring, speaking of which, Scott, I'm glad you brought that up. I was going to tell you, this is why I was going to call you the other night. So in state history, we had talked about state constitutional conventions previously, did some research. Since the statehood, 100 and whatever years ago, while our state constitution says that they're supposed to have a convention every 20 years, they've only tried to call one 3 times. One was 20 years in, and then one was 20 years after that, and then it was like 30 or 40 years later or something, and they tried it again. In order to call a convention, it has to go to a vote of the people, for the people to authorize the convention, and then whatever they would pass would then have to be ratified as well. Well, each time the legislature tried to call a convention, the people definitely did not want one. I mean, it was like 49,000 yes to like 350,000 no. Like it was
that's not populist roots.
Yeah,
Oklahoma said, don't muddle with my constitution.
Right. We put it in there. We just don't really want to use it. And then there was a couple of times that people tried to call one, and those never even made it to the ballot. Like they got abandoned along the way. So
doesn't the governor think that he has the ability to call one without, like, doesn't he think he just can?
I could see Governor Stitt thinking something like that, right? Like, just because he is someone who is testing the power of the executive branch. In my read of the Constitution, and I'm no legal scholar, but it seems like that's not the case.
Yeah, I have no idea.
But this is a random thing I did want to bring up when we were talking about how the governor is doing videos about what he's signing into law, what he's vetoing. I think that's really interesting. And I hope that he continues doing that, because in prior years we had written statements and press releases, which I'm sure still exists, but it adds another touch to hear him talk about the rationale for why he's doing what he's doing. And so I think that's a pretty cool thing that I hope sticks around from a civic standpoint.
Agreed.
Yes, I agree. I think it'll be curious. I hope like Sooner Poll or one of those groups does some polling after session, just about popularity, just because I'm kind of curious what the public sentiment is. Like, Governor Stitt has been through the ringer this spring, right? Like, this is his second session. Last year was pretty smooth, had plenty of money, had some honeymoon times, right? And then this year he bumped heads with the legislature. He bumped heads with the AG. He's bumping heads with the tribes. Like, it's
has a whole pandemic on his radar and having to implement CHEPA. Like, it's a whole lot of unprecedented things that Governor Stitt that's under his realm.
Yeah. Man. All right. Well, I think that brings us to the end of the episode. Scott, thanks for being here.
Hey, man, it's the highlight of my week. I wouldn't miss it.
You say that every week, and every week I think you're lying. But I appreciate it.
We don't ask Ashley. Ask Ashley, like, what's the thing Scott looks forward most to in the week? And she'll say, sitting with Andy and Bailey and having a whiskey and yelling about politics.
That's right.
Unfortunately, I don't think you plugged CivicsCon yet, but I'm not going to be able to make CivicsCon next week, and I'm very sad about it.
Well, that's okay. Thanks for the lead-in. I'll get to that in a second. But I want to thank Bailey for being here as well.
Thank you.
Of course. So, yes, as Scott mentioned, next Friday we will not be doing the podcast. We will be doing CivicsCon, which is a virtual conference or convention about civics, about voting, about elections, about connecting with your neighbor, and about building a better democracy. You can go to civicscon.com to register. We will be doing that as a live stream online. It's free. We'll be going from 8:30 in the morning until a little after 4 in the afternoon. It should be great. And we will, once that's done, we'll be releasing the audio from that as subsequent podcast episodes. We'll probably do a regular episode week after next to recap whatever we've missed. And then during the summer, we'll take several weeks off to regroup ourselves and to let you guys listen to what happened at CivicsCon. And then all of those videos will be made available on our Facebook page and our YouTube channel. And with that, don't forget to rate and subscribe Let's Pod This on Apple Podcasts if you listen. That would be great. It helps us connect with other people. You can follow Scott. He is at SC Melson. Bailey is at Bailey and Perkins. I'm at Andy OKC. Don't forget to like our Facebook page. Don't forget to go to CivicsCon. Our podcast is produced by the three of us. We are a member of the Mostly Harmless Media Network, which is based right here in Oklahoma City. And our theme music is called Rhino Funk by artist So Down. Let's Fix This is a nonpartisan, nonprofit organization, and our whole goal is to help people be educated about civics and be more engaged. We believe that the key to a better democracy and a better Oklahoma is having folks like you and I be involved to show up to vote. And with that, a reminder that decisions are made by those who show up. Have a great week.